Hi, Melindy. I thought you had a really good video and you had a lot of good information. Um, it's important that when we are assessing our clients that we get as much information as possible from them so that we get the best diagnosis possible, so that we're better able to help our client. So the interview, that we have with our client, it kind of observes, like gathering the information about our client, their behaviors and attitudes, their current history, um, and like their life history as well. So one thing we could do is a mental status examination. It kind of gives us an example of like the patient's mind, and the way that they look, feel, and behave about certain things. We could do like a semi-structured interview where we have like a set of questions already, that we were able to follow to kind of catch their attention. Um, there's a structured interview as well, that we can do, which covers like, it's an exam where we can like get like a proper diagnosis, for our client, and then we also have the structured interview, where we present them with, um, the questions in like the same questions in the same exact order. Sorry if I'm stumbling a little bit. And we can also do a unstructured interview, where we ask like non-direct, where we're like non-directive, in which questions are not like prearranged. We just kind of ask them random questions throughout. I thought you did really good in your video, discussing everything. So it's also important that we get an informed consent from our clients so that way they understand how we work, the things we, are going to be doing to help them properly. Um, they're aware of like all the regulations and stuff in our field, and that everything's going to remain confidential is one thing that we really want to point out. Now, if we're doing some sort of assessments and things like that, and they run a risk for potential, like maybe harm, like they talked about in the video, we want to let them know that so that way they have the option to not continue on if they don't want to. We also want to let them ask questions during the, testing and stuff as well, so that way they, feel like they're being heard. It's important though that we ask the right questions to get the proper diagnosis, because that's our main thing, is to kind of get them the proper diagnosis so that way we're better able to help them, with whatever it is that's going on with them at the time. But I thought you did really well, and I hope you have a great week. Bye.